Doffing, removal of PPE. Remove all PPE before exiting the patient room except the mask, if worn, which is removed after leaving the patient's room and closing the door. Before removing the PPEs or the personal protection equipment, it's very important to know which areas of PPE are considered contaminated versus which are clean. The contaminated areas of PPE are outside of the gloves, front of the gown and the gown sleeves, front of the goggle or face shield if you wear it, front of mask, respirator. So we need to be very careful not to contaminate ourselves on removal of PPE. To safely remove PPE without contaminating your clothing, skin, or mucous membranes, use the following sequence. The correct sequence of doffing or removing PPE are: number 1, gown and gloves; number 2, goggles or face shield if any; number 3, mask or respirator; and number 4, hand hygiene. First, remove the gown and the gloves together. Remember, the front of the gown, gown sleeves, and the outside of the gloves are contaminated. Grasp the gown at the chest and pull away from your body so that the ties break, touching the outside of the gown only with your gloved hands. While removing the gown, fold or roll the gown inside out into a bundle. As you are removing the gown, peel off your gloves at the same time, only touching the inside of the gloves and gown with your bare hands. Place the gown and gloves into a waste container. If your hands get contaminated during removal, immediately wash your hands or use an alcohol-based hand sanitizer. Next is removal of the goggles or face shield if you have one on. The next step is removal of the mask or respirator. The front of the mask is contaminated. Do not touch the front of the mask. Grasp the elastic ear loops of the mask and remove over ears without touching the front of the mask. Place the mask into a waste container. Next, wash your hands or use an alcohol-based hand sanitizer immediately after removing all PPE.